Hello, this is Dr. Gary Huddleston, owner of AccuFlex Tables. I'd like to thank you for watching our video library. In different short videos, we will explore and explain the different and specific Spinewerx decompression features on how they would apply to a patient. This short video will be initial setup once you have your new Spinewerx decompression table into your office. Please note that we do offer a special white glove service. This service, while an option, will have a specialist bring your table into the room of your choice, unbox it, set it up for you, and remove all packing materials. Please call us if you're interested in this service. Your new Spinewerx decompression table will come by motor carrier, and they'll call you before delivery. When the table shows up, unless you have opted for white glove service, they will unload the table at your door, and the container will look similar to the one shown here in the picture. Remove the cardboard box from the shipping crate. Remove the table from the shipping crate by cutting the plastic hold-down straps. Gently lift the table off of the skid. Do not slide the table, as this could damage the floor glides. You must have an assistant help you with this operation. Never lift the table by the cushions. Always lift the table by the metal framework. You will also receive a couple of boxes inside. One is a decompression head, and the other contains your harnesses, bolsters, cervical decompression unit, and other items. Now run the power cord and foot controls under the base to a desired location, keeping them away from any of the moving parts on the table. Remember to place the table on a level, non-slip floor. Placing the table on an uneven, slippery floor or very thick carpeted surface may cause the table to slip or slide during use, resulting in injury to the patient and/or operator. Become familiar with all the locking and biomotion handles. Remember, your Spinewerx decompression table has true spinal movement, so there will be more locking handles. Here is the lateral flexion handle. Here is the axial rotation handle. You can actually adjust each handle by pulling out, rotating the handle, and then releasing it into place. Always make sure the locking handles are secure before placing a patient. The thoracic belt, as mentioned, will be inserted into retaining buckle for your convenience. After you unpack the one box with your accessories, you can now unpack the decompression head. Please use caution when opening it. Carefully remove the decompression head and the DVD and other materials. You are now ready to attach the decompression head to the mounting plate. The decompression head can face either left or right when looking from the back of the table. Use the enclosed wing nuts and align the holes in the mounting plate to the holes in the decompression head. Insert all 4 wing nuts before tightening them up. When all 4 wing nuts are aligned, tighten them very snugly in a clockwise pattern. Finally, and use an assistant if necessary, slide the decompression mounting bracket into the receiver at the back of the Spinewerx table. When inserted, use the locking pin and lock into place at what distance you want the decompression head from the table. Plug the pre-run electrical plug into the back of the decompression head as well as the stop switch. Finally, plug the plug into a grounded 110 volt outlet and you are now ready to go.